I'd like to welcome everyone here this afternoon. Yeah, it is after 12:30. And if we'd have roll call, please. Starting with you, Dr. Joel.
Joel McCullough, Spokane Regional Health District.
John Snyder, City of Spokane.
Bob Lutz, appointed citizen.
Mike Fagan, City of Spokane.
Ann Pisnagle, Recording Secretary.
Michelle Fossum, Legal Counsel.
Ed Pace, Spokane Valley City Council.
Chuck Hafner, Spokane City Council and Chair.
Spokane City Council.
I know. Now, you need to know what the joke is on this. I always miss her at meetings. Okay.
Amber Waldrop, Spokane City.
Okay. She or Shelley, one of the two I miss all the time. So, and Keith?
Keith Baldwin.
Okay. At this time, I do not have any reports to my chair, other than the fact that I think we're going to have a long session today, and so I want to provide time for all the business that we need to do at this stage. Health Officer report, Dr. Joel.
Today I'll be talking about 3 topics. The first thing, I will be giving you an update on the measles, followed by update on seasonal influenza, and then finishing up talking about the bird flu. So in terms of the measles, from January to 1st of January to 20th of February, there have been 154 cases of measles reported in the U.S., and this involves 17 states and in Washington, D.C. But 118 of those cases are part of a large ongoing outbreak that's linked to Disneyland in Southern California. And there have been 2 other outbreaks, 2 other smaller outbreaks in Nevada and in Illinois. We're seeing an increasing number of measles cases. So for example, last year, in 2014, there were 644 measles cases involving 27 states, and that is the largest number since measles was eliminated in the United States in the year 2000. And one of the issues is measles is very common in other parts of the world, including some parts of Europe, Asia, Pacific, and Africa. And sometimes travelers can bring measles to the U.S., and conversely, U.S. residents can bring measles back from traveling overseas where measles is very common. Here in Washington State, there have been 5 confirmed cases, and they involve 2 counties, the counties of Grays Harbor and Clallam counties. There have been no cases reported here in Spokane County, but there have been several cases tested for measles, and they have come back negative. In terms of SRHD's role, we send alerts to providers to make sure that they are on the lookout for measles. We provide providers with proper testing protocols, and we facilitate testing of clinical specimens. The next topic is the seasonal influenza. Influenza remains widespread amongst most parts of the country, and here in Spokane and most other places, influenza activity appears to be declining. The most common variant for influenza this season is the H3N2, which is the predominant strain. Also this year, the highest hospitalization rates have been in those who are 65 years old or older, representing about 60% of the hospitalizations. And the next highest group that with high hospitalization rates are children that are from 0 to 4 years old. Here in Spokane County, there have been 15 deaths associated with influenza, and there have been 353 hospitalizations. Some things of note for this flu season is that there was a mismatch of the flu vaccine this year. As I mentioned earlier, the H3N2 virus is genetically different from the H3N2 vaccine strain, so there's a significant mismatch. So it's about 1/3 as effective as it's about 1/3 active against this strain of influenza, which is significantly decreased from previous years. And another issue within this season is the issues of a swelling of the parotid, the salivary glands. So since December, CDC has received reports of swelling of the salivary glands from people with laboratory-confirmed influenza. And the majority of these cases involve children, and it's traditionally been associated with mild illness. And CDC is continuing to investigate to determine the cause. So finally, I was asked to talk about bird flu or avian influenza. Bird flu is a viral illness found in birds, and these influenza A viruses occur naturally among wild aquatic birds, and they can infect domestic poultry and other birds and sometimes other animals. So there's generally two strains. There's the highly pathogenic strain and the low pathogenic strain, and we're concerned about the high pathogenic strain because they can cause severe disease and death in birds, and they can rapidly spread through poultry flocks. So since December of last year, the USDA confirmed the presence of highly pathogenic avian influenza in wild and domestic flocks here in the West and in the Northwest. There have been 3 separate strains identified, and all 3 strains have been noted in other parts of the world, and they have not been found to infect human beings. But we're also advising that people follow precautions when dealing with wild birds. Certainly use proper hygiene. Do not handle sick birds, and especially with bare hands, and to cook any meat that you have thoroughly. In terms of the agencies in charge, the Washington Department of Fish and Wildlife is the lead agency here in Washington State, and they've been working in collaboration with U.S. Fish and Wildlife and the USDA to have nationwide surveillance efforts for the early detection of highly pathogenic avian influenza in wild birds. That's all I have today.
Any questions to Dr. Joel?
Yes, sir.
Mike? No, go ahead. Keith?
Yes, Doctor, do have a question because I ended up listening to a little bit of coverage on the radio this morning from KXLY, and they were interviewing a representative of the health district, and they were talking about the flu here in Spokane County. Now, according to the CDC's webpage, and again, I don't know if we're talking about the same strain of flu, but they're reporting that this year's vaccine is effective in 23% of the cases. Now, you just reported that there's a mixed match in the vaccine, and it's only effective in 1/3 of the cases. I think it's rather important that as the Board of Health, acting upon this board's values and our mission, that we should have made it a point to put out the correct information if, in fact, that is the correct information. But I didn't hear any reference at all during that interview about the effectiveness of this year's vaccine. Now, if it's the position of the Board of Health to promote this vaccine, how can we do that? And do that without thinking that it is the wrong thing to do when it's only going to work in 1/4 of the cases.
Do you have a question, Mike? What are you asking the doctor?
What I'm asking the doctor, I guess, is when we do put information out, can we do a better job of, again, if I'm hitting this thing right, next time we put the information out, can we put out all the information and at least make that request of the media to do that?
Okay. Todd? No, Keith?
Can Dr. Joel?
Yes, I think
You're going to defend him.
I think in terms of the 23% you're referring to, an earlier report put out by CDC in January that quoted that 23% amount. And so there's been additional studies that from CDC that puts that number up to about 1/3. So, certainly the health district is always interested in putting out the most accurate information possible. We credibility as a state if we do not do that. So we always strive to put out accurate information as much as possible. In terms of the context of the interview this morning, I'm not sure whether that specific question was asked or not, but certainly I provided the information here today, which I think it's important to note the effectiveness of this particular vaccine, and I've talked about previously the effectiveness of other vaccines as well. So I agree that accurate information should be part of the information we put out.
Thank you. Keith?
Yeah. Dr. McCullough.
Yes.
There was an article in the paper this morning, I think, about avian flu in India and some precautions they were taking there. Does that relate in any way to any of the avian flu seen or might see in the U.S.?
There are many strains of avian influenza, and I noted there's been 3 identified here since December, and it depends on what strain the paper was referring to. So here are the strains that have been identified here so far in the Northwest and West. So certainly it's important to have surveillance determine what's circulating, because as I said earlier, it can affect both wild birds but also domestic flocks as well. But I also, as I said earlier, these particular strains have not been found to infect humans. So it's very different from the bird flu that was circulating in China several years ago, which caused hundreds of deaths. So this is very different from that.
Thank you.
Commissioner Melky?
Thank you, Mr. Chair. So a question to Dr. Joel, or perhaps Dr. Lutz, not necessarily specific to avian flu, but just the flu season in general. My understanding is that typically you may have multiple strains that come through in a season, but you probably have a predominant one. I mean, is that true? Because, I mean, if we get so fixated on one vaccine and its effectiveness against one strain, that's really not reflective of the flu season, or do I just have this wrong?
That's correct. I mean, there are generally predominant strains circulating. And the current, there's generally 2 different types of, there's multiple types of flu vaccines, and they're trivalent and quadrivalent, so there's 2 types of influenza A and 1 type of influenza B, so we want to have as greatest coverage as feasible. So yes, there are multiple strains circulating. Generally, they're a predominant strain, and these strains have different characteristics. So, for example, as noted earlier, this is mainly affecting those who are elderly. And also, stepping back a little bit, one of the challenges with vaccine production is that there needs to be several month lead time before the vaccine is produced, and this particular strain wasn't found until after the production for the North American vaccine started.
Okay.
So it was a timing issue in terms of including this particular strain in this year's vaccine.
So it's really less about whether the vaccine was effective or not. It was more about, whether we predicted the predominant strain this season.
Yes, there's some years there's a really good match, and some years there's not. And it depends on how quickly the influenza changes from the time the vaccine is chosen to the time that it affects the different parts of the world, because there are generally 2 different strains. There's North American strain and South American strain, and the strains are chosen based on what's predominantly circulating several months beforehand.
Okay, thank you.
Any other questions? Dr. Joe?
Actually, Chuck, if I may, and Commissioner Mielke, I think you hit a very important point. Obviously, this year's vaccine, it's not that it's ineffective against the types of influenza that it was predicted to take care of. The reality is, as Dr. Joel said, we've seen that which was projected to be the predominant strains this year are not. And so that's, again, I think the real important point to make home, yeah.
Okay, very good. Any other questions? Okay, thank you, Doctor. Thank you. Okay, legislative report. Linda, please.
Hello, good afternoon. Just want to give you a quick update on bills before the legislature that relate to the legislative agenda that you adopted back in December. But I do want to note later on in your agenda, there's an action item related to a resolution to adopt your legislative agenda. So that'll be up later for consideration.
Okay.
In your packet, I did send out, at the time the packet went up a couple weeks ago, where things stood, but you should have in front of you a latest version as of yesterday. And a couple things to note that changed from yesterday to today. Under rail safety, House Bill 1449, that one has passed out of the committee without amendment, so it should be moving on. And then distracted driving, Senate Bill 56, that one was exec'd out yesterday, and it does have an amendment on it. My understanding is the amendment was really aimed at addressing devices that are built into cars these days. Electronic cigarettes and tobacco omnibus legislation on the next page, House Bill 1645 and Senate Bill 5573. These are significant priorities for public health partners across the state. Unfortunately, they are currently not moving. They have not been scheduled for hearings. These bills have a regulatory piece for both e-cigarettes and tobacco, and also implement taxes on e-cigarettes. And the largest concern we're hearing so far is on the tax piece, and that's why they haven't been moving. Also, because they're necessary to implement the budget, they've had more time to get through the process than the other bills, so they've just been waiting. There was a big meeting yesterday with several of the legislators engaged in this, so hopefully we'll know a little bit more really soon. I think we're hoping for a hearing. The last we heard was the first week of March. So, one other update, or a couple other updates. Recreational marijuana, House Bill 1276, down the bottom of the page. That one was also exec'd out of committee this week. The third page, Senate Bill 5973. It's actually 5903, my apologies. And that one did pass out of committee this week and is moved on to rules. The one legislative agenda item that you had related to the mid-level dental providers, and that bill has not received a hearing. It won't be moving on. So, but it will be there for next session. It'll be still there. A couple updates on budget issues on the last page. The public health assistance account, so far not seeing any changes from previous allocations, so that's looking okay. Communicable disease funding, there is $10 million in the governor's budget, which is an increase over typical. Recreational marijuana, we're waiting for the official allocation from the legislature, but there's about $19 million expected in funding. That will go to Department of Health for prevention and education efforts and for grants then to local health jurisdictions. So we'll be watching for further stuff on that. And then currently youth tobacco and e-cigarette prevention, there's $3 million in the governor's budget. So any questions or other items of note?
On the mid-level dental provider, what was the hang-up there? Were they just out of time, or?
No, the biggest hang-up is Washington State Dental Association had some concerns, and the proponents had hoped they would be able to work it out. Apparently, they weren't able to. So,
is there anything that we need to do to lobby harder, better, different, or whatever?
Yeah, at this point, I don't think public health's input on that will make the difference. I think they're really looking to the Dental Association to come on board with that or to suggest some alternatives. My understanding is they will be working during the interim, and the bill will still be there again for the next session, so they're hoping they can resolve the issues and pick it back up again.
Okay, thanks.
Sure.
Any other questions you might have for Linda, please? Thank you, Linda.
Thank you.
Good job. Go to item number 6 on the consent agenda. They include meetings of December 4th, 2014, And vouchers November 1st through 30th, 2014, December 1st through 31st, 2014, and January 1st through 31, 2015. Are there any of those items you'd like to take away from the agenda? And do I hear a motion to accept those, please?
So moved.
Do I hear a second?
Second.
Okay, here, second. Any debate, discussion? All those in favor signify by aye.
Aye.
Those against? Thank you very much. Let's go to item the Governance Committee. Recommendations for Policy Committee Board Member Baldwin and Linda Graham. Who's taking hold of that one? Linda?
Did you want to do your meeting schedule
Oh, I'm missing that, yeah.
Do you want me to just stand up here?
I'll come back to that. I'm missing one step.
Did you have something else?
No, I
Okay.
just missed another agenda item usual, but that's okay.
You can back up if you want. It's
Well,
okay.
let's do this. Let's
Okay.
go to item 7A, adopt a 2015 meeting schedule.
So moved.
Second? Second. All those in favor?
Aye.
Thank you very much. Go ahead, Linda.
Okay, thank
That's
you.
probably why I missed it.
I'm here with a final recommendation that came out of the Governance Committee. And this is about policy activity for the Board of Health. I do want to emphasize that this is different from the work you've already done on the legislative agenda. That's a separate process. What we're talking about here is proposed work for the Board of Health on policy recommendations that you will have to the community. And what we're looking at, the committee is recommending is that your policy activity have two forms. One would be resolutions, which is something you have typically done. And these are more official or formal statements about decisions or opinions or asking for other jurisdictions in the community to pass certain policies. Some examples of previous work are the recommendations concerning e-cigarettes and preventing the sale to minors. And following your resolution on this, several of the local jurisdictions did pass resolutions prohibiting sales to minors. Another example is bike helmets, with some of the previous work you've done. The other piece of policy we're looking at are guidelines and recommendations. And these are more non-binding advisory opinions. You have not done these before, and several jurisdictions don't do this, but they are being implemented in jurisdiction across the state. These are a lot more educational in nature. An example might be encouraging owners of apartment complex to implement no smoking policies. And then it would come with educational materials about how they might do that, samples of policies, those kinds of things. Another example would be encouraging businesses that have vending machines to implement healthy snacks in those vending machines. And again, having a toolkit and some guidelines about how to go about implementing those policies. For the process, what the committee is proposing is that we start in summer and fall with myself and health district staff identifying potential policies and doing some initial research on those. And then in January, as we'll talk about with the next action item, is appointing the Board of Health Policy Committee. And then February and March, working with that committee to really look at what policies we do want to proceed with, priorities and schedules. And then the ongoing work would be according to that schedule. We might need to do some additional research and coordinate with the Education Committee on bringing information to the board. It would be working with staff to develop all the details that need to either be in the resolutions or be in the guidelines and recommendations, and then finally bringing these forward for Board of Health action. So for the Policy Committee, the purpose is really to help assist in determining which policies the Board of Health might want to consider each year. The recommendation out of the Governance Committee is that the Policy Committee would not make recommendations to the board on policy. They would simply make recommendations to me on process and what to bring forward. And the committee would help advise on the proceedings we might do. Do we need special hearings or anything on particular controversial issues, that kind of thing. And we're looking at the membership, wanting it to be at least 3 members, and then the health officer, and then myself. And looking at the policy committee members serving 1 year, so every January. doing a reappointment of those. So the Board of Health action we're looking for today is approval of the Governance Committee recommendations, the policy process we've talked about, establishing the policy committee, and then using the Education Committee to help determine what educational needs are needed by the board for each of the policies. So, and that's the resolution before you, is to adopt those recommendations.
Okay. Shelley?
So I guess I'm trying to figure out, I mean, I'm reading the criteria, which is supposed to help vet some of the issues that come before, but do you actually need the Board of Health to take, for non-binding advisory opinions? So for the example you give about encouraging the use of vending machines, healthy vending machine guidelines, oh, sorry. Do you need the Board of Health to do that? I mean, don't we provide information in different areas and categories already?
There are a certain amount of work that, program staff are doing in those kinds of areas, working directly with different businesses. What we've talked about in the Governance Committee is using the Board of Health as another mechanism to get the word out and maybe to get broader response, to show broader, the support of the board behind this. And it's just another mechanism to kind of carry the message to encourage greater participation.
Keith?
Well, I'd just like to say, as we had this conversation within the governance committee, I think part of the issue was just to have better communication across the board so that when these things were happening, that we would be more aware as a board, and that would help in our own communication and our own discussion of issues as well. I think that was one of the benefits of talking about these issues within the governance committees, that we became much more educated amongst ourselves about process and topics and that sort of thing as well. So I think there was a benefit just to us as a board for sort of processing these issues and bringing them forward as much as a benefit to the public. So.
And I think making us aware, and the more information that we receive, the better decisions we can make. So I think that was part of it, to get more and more board members involved in what we're doing with the health district. So I think that's good. I'm not sure who had their hand up first.
Go ahead, Bob.
Okay. Go ahead, Bob.
Yeah, and Shelley, when I brought this idea a couple of years ago, it was based upon some experience in Seattle King, where they had initiated these guidelines and recommendations. And what they did was they sort of vetted it through the Board of Health. They specifically looked for those issues which Board of Health members found relevant and wanted to work closely with staff on. And so, for example, the first two that they made use of was healthy vending machines and land use policies. And then Board of Health members worked with staff to create sort of white papers and, as Linda said, sort of toolkits, which then went out to the community to be made use accordingly. So just another means, as I said, as Chuck and Keith said, is how to bring the board together, get them involved in some of the issues that were deemed relevant for the agency and for the community.
I like this. It looks like a good process, and I'm looking forward to being a part of it.
Great.
You'll have that opportunity because there's there will be a
Does that mean
sign-up
you're
sheet
volunteering
coming
for the
around.
committee?
Okay, Todd?
Thank you, Mr. Chairman. I have a question on the, as I look through the process, how rigid are we with regard to the timelines? And the reason I ask that is, especially when the legislature is in session during the long years, we may not see something coming that we either want to take a proactive stance of support or opposition. And this process kind of contemplates that, that early in the fall is when we would really first start considering ideas for resolutions, guidelines, or policies.
Yeah, a couple of thoughts. Keep in mind, this is different than the legislative process. This is really meant to be work of the Board of Health. Also, I wouldn't consider an absolute rigid timeline. We just kind of set out some recommendations. But certainly, I think the Board of Health is flexible enough, and the committee can be flexible enough, that if something comes up at any point, we can bring it to the policy committee and say, what do you think? Should we bring this forward?
I believe this is just a guideline at this stage.
Because I don't know of any policies or WACs or statutes that prohibits us from communicating a position on any issue at any particular time if the full board agrees to it, and it's certainly within the parameters of the law.
Right.
Well, this is just the way to have the conversation.
Right. This is where we want to be proactive.
Yeah.
This is where we want to have the conversation.
Okay.
Shelley?
So my question actually ties nicely with what Commissioner Milky was bringing up, is I guess I'm curious, do we have a requirement that anything that comes up throughout the year will first go through the committee before coming to the board? And I guess if we don't, I would like us to consider that, and trying to think about how politely to put this. I guess what I don't want to happen is if there is a battle going on at City Council on Monday night, that just comes here and continues on a Thursday, if it's health related, without the rest of the board having had the opportunity. Because you guys as City Council may be fully into the conversation, have all the facts and details. I'm giving an example. It could be, let's say it could be at the commissioners meeting on a Tuesday night if an issue is raised, and so it could be vice versa. Without us the other jurisdictions having the opportunity to catch up on the conversation. So I'm just thinking process and timing if we could.
That's not going to happen. I mean, I'm just sorry. I mean, you presume an amount of control over the public that we don't have.
No, I'm saying for board action is what I'm asking, though. So if we were to take a formal, I mean, we may have folks like we do today come and speak on an item that was raised at City Council, but for the board to take action on an item, is there a process in which if we're going to be making statements, that it would go through prior to the board taking an action?
I have a couple thoughts. The chair, first of all, could regulate that so that it wouldn't happen, because it hasn't been brought before this board to look at and discuss. So under those particular circumstances, it's not appropriate simply because it hasn't been brought before us in the manner that it should be. So I would think whether or not we have to have something written, and the fact that would happen, I really think that the exec meeting people can do that, or as the board today, if there was something came up, I can simply say, that's not on the agenda, we're not talking about it.
Yeah. And that's kind of what it was getting at for formal
and
action, not conversation, formal action.
John?
Well, I just think there are two totally separate things here. We're talking about trying to create a mechanism so that the Board of Health isn't so surprised by these policy discussions. It gives us a chance to get ahead of them, to stake out our own process on them. To me, that's the value of doing this. We can then kind of determine, it's almost like we're creating our policy work plan for the year. And if staff doesn't decide it, board decides it. That seems appropriate to me. There's always going to be health things that come up that may happen in our own jurisdictions that may bubble up to the board. Not a lot we can always do about that. And there's also going to be situations where individual jurisdictions may take action on a health-related matter that this board doesn't agree on. I see that as a possibility as well, too. So while communication would be valued in those kind of situations, I don't think we can ever prevent what you're suggesting.
Well, and the discussions at the governance committee, from my recollection, is the intent of these is to really look proactively as a board of things you want to discuss and bring forward, but the mechanism then for any other things that happen along the way or last minute issues can be a whole separate process.
Okay. Any other questions of Linda? Amber?
Oh, no question. I just think it's a good process. I really appreciate the work of the governance committee, because in our bylaws, you know, we have the opportunity to pass these resolutions and guidelines, but we really haven't had a process by which to do that. So I really appreciate, Linda, your work and the work of the governance committee. Look forward to it.
Okay. Ed, any comments? No.
What's that?
Okay, thank you, Linda. Now, speaking of committees, we have 5 of them. Budget and Finance Committee, Dr. Lutz has consented.
Finance?
No. No, okay. Budget and Finance, I think that we have Shelley O'Quinn, our commissioner, will chair that. Education Communication Committee, Bob will chair that. The Governance Committee, Keith Baldwin will chair that. And the Policy Committee will be chaired by John Snyder. Now, we do have sheets, don't we, Ann? We have sheets where we want people to sign up for those particular committees?
just need to stay here at the meeting.
Before they leave, is that? Okay, before you leave today, please sign up for which one of the 4 committees you would like to serve on. And we also then, for those of us, including myself and Dr. Lutz and Kevin Freeman and Shelley O'Quinn, we have a TFE permit ad hoc committee that we're setting up, and that's an ad hoc committee, which means it'll convene for a number of meetings, and then hopefully we'll get our act together and complete that task. And I think that Ann is looking now at dates for us. Is that correct, Ann? And has everybody responded to you when they might be available?
No, they haven't.
Would you kindly do that if you haven't responded, so that we can get this committee set up and going there? So I would like to have a motion to accept the chairs of these committees at this stage, and then sign-ups can happen afterwards.
So moved.
Second?
Second.
Is there any debate? Okay, all those in favor signify by aye.
Aye.
Those against? Congratulations to all of you.
Can I say something about this one?
Yes.
Okay, so since we didn't have our committee meeting last month, we did go ahead and postpone. But the permit ad hoc committee was actually, came as a result of having this conversation for the last 2 years, and we have it every year in the finance committee, where we talk about the fees. And then every year what happens in the finance committee is that the fees have already been established by the time we get to that conversation for the budget, and so they can't be changed. And every year we talk about how we need to still review it. So we are doing this meeting now, and it needs to meet and convene by the time we get to the budgeting cycle in May, when they need to establish the fees for budgeting purposes. So if you're interested, it's been a complaint every single year. So this is your opportunity to be involved in that conversation about fees.
And due to the fact we didn't have anybody sign up on the first request, and that's where Dr. Lutz and myself and Kevin Freeman said that we would be part of that committee. Okay? Anything else you want to talk about on the committees? Anything? Okay. Well,
Todd did raise a quick question on the governance committee's recommendations about policy. Is it that we are going to vote on those recommendations next meeting? Is that correct?
I think historically with the recommendations related to the governance committee, you've just all kind of given a nod and a thumbs up at the meetings, not necessarily doing a resolution.
Okay, thank you.
Okay, item number 7E, resolution 15-02, adopting the Board of Health legislative agenda for the 2015 State of Washington legislative session. Do you want to speak any more about that, Linda, than you have already? Do I hear a motion to accept it, please?
So moved.
Second.
Any discussion? Okay, Mike?
Yeah, I won't be supporting the legislative resolution 15.02 by virtue of, I'm sorry. I won't be supporting that particular resolution by virtue of the fact that there is a subject matter on there that I am not supportive of, and that would be the paid sick leave at this point.
Okay, thank you. Any other conversation regarding any of this? Shelley?
Well, I guess I'm curious, I thought we voted on this. So I want to know, I mean, we voted, we had the discussion associated with all of the different policy positions that we each felt strongly about on many of the different ones. And why are we doing this again?
It's just putting it into a resolution form. This is more formal process. So you have approved the agenda, you're just making it into a resolution.
Okay, I guess what it's failing to capture, though, is all of the conversation that went into when we actually voted on this. Because we had quite a dynamic conversation around it, And so while you're putting it into resolution here, what I'm afraid is going to happen is, okay, we unanimously or -1 approve this, but you failed to capture the conversation that happened, which is actually all associated and tied to the previous motion and approval that was made. So I'm not necessarily sure I like the fact that we're re-voting on something. Well, because you're failing to capture all the conversation that went into it, which was very, there was lots of opinions on each side. We took a look at each issue. We talked about each issue, some of which I agreed with, some which I didn't, same as all of us. And so I'm trying to figure out why we're doing this again.
We were asked to bring forth a resolution for you to consider whether or not you wanted to do a resolution, and so it's here.
I guess I would agree with Shelley on this. That was kind of a hard-fought compromise. Things came in, things went out, and I thought it was kind of done then, and I would hate to go through that again. So I almost think maybe we've missed our chance to do a resolution on this year, and the next time we talk about it, I'd hope we're kind of talking about maybe 2016 instead of 2015. So I support passing this today, but I would also be fine with us just not doing it because I feel like we've already taken
Shelley, are you asking when you say you haven't captured it, what would you like us to do?
I'm with John as that I would say we not vote on this. We did the hard discussions, we did the hard votes, and we captured that in a previous conversation. And without us having an additional conversation around it, which I fully agree with John that we shouldn't do. We've already been there, done that. I'm not comfortable voting on this item either.
So what you're asking us to do, not to vote on this, because if we do vote on this, then we're not showing Mike's particular interest in some of the items. It's not a total group voting. Is that what we're saying?
Well, it's more saying this should have been a one-touch item.
Yeah.
Yeah. I don't know which one, Keith or Todd.
Well, I think the important thing here is that we all agree that we agreed on this issue as a board. So we're not going to have dissenting opinions to the public on a regular basis because that does not help us put forward the public health issues that we're talking about here. So I think that's the bigger issue, is that if we all agreed with this before, if we all agreed with putting up there those issues that we did on a majority basis, then we need to all follow through as a board and agree that that's what we're going to support for the year. It's a board decision, not an individual decision.
Commissioner?
Thank you, Mr. Chairman. So I believe this fall when the discussion took place, I think I was participating in a public health task force on the other side of the state, so it was not part of that discussion. My concern today is the document that's before us looks more like a legislative tracking document. Tells me what bills were introduced, what the bill numbers were, short description, and the status. Policy issue that just says rail safety or distracted driving. I don't have unless I've got a different packet than everyone else, I don't have a document in front of me that tells me what was adopted by this board in the fall.
Is the resolution not in there? Because the resolution should just have the legislative agenda that you adopted.
It is.
All right, I will look.
Thanks, John.
Yeah. John, as the new chair of the policy board, would you then give your opinion, please?
I'll take full responsibility for this message.
Thank you.
If that's what you want. I think that the thing is that if anything is a one-touch item, it's a legislative agenda, because even though there's a lot of things on the board we may want to revisit, the problem is we have to freeze a legislative agenda before a session. Now we have the session half over. If you look at the tracking document Commissioner Milkey's talking about, there are whole items that are now out of discussion because they haven't made it out of committee. I don't want to go back and pull them off. I don't want to, like the dental thing, for example, even though we know that's dead now, I think it's good that we froze that discussion in time in December, and we shouldn't hit it again in February when we're in the middle of the session. Now should be the time, if there's a particular issue on this that has some momentum that we're behind, that we feel like we want to put out a more forceful resolution or a letter on, like, say, one issue that the whole board can agree on, this would be an appropriate moment if we think it'll give some legislative oomph to the discussion before the end of the session. But I don't want to see us getting into, like, going over a legislative slate again halfway through the session.
Yeah.
Okay.
And
Let's see who's next. Go ahead, well, Linda?
no, I just, again, we were asked to bring it forward, and I was just going to ask if Michelle had any input from the resolution standpoint, the necessity of doing it, or is it really up to the board about whether they wanted to do it?
I don't think there's a requirement that there be a resolution to solidify that. If the board was inclined, given Commissioner Quinn's concerns, one option would be to incorporate the minutes and that discussion from the last time. I'm not suggesting that we do that, but it'd be another option.
Okay, thank you.
Okay. I'm not sure, Ed?
This is just a resolution documenting what we already decided.
Correct.
So I don't see what the big deal is. Let's just pass it and move on. If there are items on here that we want to lobby for more vigorously, then we can do that without changing it. And then a comment for Councilman Fagan. I would agree with you about the sick and safe leave if we were lobbying for a requirement. This is not. This just encourages legislation that encourages employers, and that's fine. So I think we should just pass this and move on.
Well, someone reminds me,
Shelley?
didn't we go through each of these items and vote? And so they were not unanimous votes, but if it had a majority vote, it made it on the list.
that's
So
right.
what you're asking us to do now is to accept the whole thing when you actually, before we had gone through piece by piece and voted and put this together.
But then we did a final vote for everything
Yeah,
after it
because
was
we
all
allowed
done.
time for stuff to get on and off
Yeah.
of this list before we voted on it.
But at the end, we voted for the whole slate.
Correct.
The majority of what's on here I agree with. There are a few items I have concerns with, and that's why I'm just wondering, we at least need to tie the other minutes to it so that that's captured? And I would go where John was going, that we just not even vote on this, we've already done it, and if you want a resolution, let's make sure we do it next year.
Can I amend the motion?
Certainly.
All right.
There is no motion, so.
There's no motion yet.
Oh, I'll make one then, okay. My motion is, I move that we pass this resolution, but then we attach the minutes to it. Leave this document as is, attach the minutes to it, pass it.
I'll second that.
Okay, and further discussion? Todd? Commissioner Todd, I'm sorry.
I would make a motion to amend. And my motion to amend would be to table the discussion on this item and revisit it in the fall of 2015 in anticipation of the 2016 session.
I will second that.
Okay. Does everybody know what the motion is?
And if I could speak to my motion to amend, like I said, I was not part of the discussion, but it sounds like this board spent a great deal of time going through individually as well as collectively and put together the legislative package. If that's been done, it's been done. And it moves forward. That is where this board is on record. I am concerned, as John mentioned earlier, about the message that you send to the legislature, it's perceived to be adopting a position mid-legislative session. And I think I've spoken on this before, which is if you're going to be effective in the legislative process, you at least have to be perceived as knowing what that process looks like and knowing when the cutoff dates are. I think it damages the credibility of this board to suddenly put out what is going to be perceived as a newly adopted legislative agenda 3 months into the legislative session, as opposed to just doing
Can
what
we
you guys
call the
did.
question, please?
Question has been called for. We have to vote on whether we want to go for the question. All those in favor?
Aye.
He needs a second.
I don't think you need a second on that, do you? When you call for the, I don't think you do you?
There was already amended and somebody seconded.
No, there's the original motion. I made a motion to amend it.
Amended.
And there was a second.
There was a second.
And there was a second. And so
There
then I
wasn't
get
a
to
second
speak
on
to
that?
I get to speak to my emotion.
Right, which you did.
And so-
Mostly.
And now we vote on it?
Which one are we voting on?
We're voting on Todd's
On the
amendment.
amendment.
Okay.
To amend it until, could we read that amendment, please, Ann?
I don't know if I had it correctly down, but motion to amend the previous motion to table the discussion on the item and revisit it in the fall of 2015 for the legislative session in 2016.
Okay. Is that your understanding?
Right. Recognizing that you guys have already adopted a position this fall.
And has there been a second in that?
I did.
Yeah.
Okay. So we can call for the question for that one.
Call for
So all those in favor?
Aye.
Aye.
In favor of what, calling the question or?
For the
motion?
amendment.
For the
Oh, the
amendment.
amendment, okay,
Now.
sorry.
Okay, all those in favor of the amendment,
Of tabling it until next.
to table it until the 15th, all signify by aye.
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 Those against?
No.
Looks like the nays have it, so the next
We
motion
want to do
is
a
Better do a.
hand count. How many went to
table to the fall.
table the motion until the 15th, 2015? Raise your hand.
6.
We already voted on it.
Okay.
Oh, is that a seven?
Oh, no, I'm
Okay,
waiting for your
that-
nay. Are you doing the nay now?
Commissioners, it passes. It's okay. Now we have another motion on the floor, if I recall correctly.
You have the motion as amended.
That is, didn't we accept?
Motion as amended.
He amended the motion.
No, I thought there was another motion that we had, came up before that Ed had made.
That was the original motion. He amended it,
Okay.
and then we
Okay, so
voted to pass.
that's a done deal.
the amendment.
Okay.
Excuse me, Mr. Chairman. So you have the underlying motion. It was amended. This last vote was to approve the amendment. You now still have before you the main motion as amended that's just sitting out there that we have to vote on.
Right, now we have to vote on the motion to table, basically.
Right.
Right.
So same vote.
Yeah.
So do we have a second to that?
We don't.
You don't need to. You're just back, you're
Don't
just
we
back
have
to
to
the
do
final
that?
vote.
No, we just
have
need a
to
vote on
again.
that.
Same
Okay,
vote.
same vote, okay.
Pass.
All those in favor?
Aye.
Aye.
Okay. Those against?
Nay.
Not voting.
Oh, I changed my vote.
Okay. All right.
This has been a confusing process.
This hasn't been my
We
day.
voted for something, but we don't want to vote for it again?
Okay. And number 8, let's go to this now, on reports. Are there any reports? No reports? Okay. Board member check-in. Anybody like to say anything?
We skipped it.
Your resolution, adoption of the strategic plan.
Oh, yeah, I think we skipped the strategic plan.
Oh, this one, God, I need to go home.
We started early today.
Let's go to 7D, please. And that is to adopt the 2015-2017 strategic plan for Spokane Regional Health Department. So Linda, help me out and save me, would you please?
I'll see what I can do, Chuck. Okay. So before you use the resolution, I was asked to do a brief presentation, a review of the process, kind of touch on some of the highlights that are part of the strategic plan, answer some of your questions, and then you can move on to adopting the resolution. So in terms of the process, this gives you kind of a quick overview of what we did. We started late in the summer, and we're actually done on time in December. The executive committee approved the strategic plan in December, and now we're bringing it forward to you in resolution form. Part of how we got our work done was with a work group. These folks represented divisions and programs throughout the agency, and they really did the bulk of the work to get this thing done. It also included 3 of the Board of Health members, as you can see. We did have a consultant who advised on the process and really helped us to emphasize gathering staff input, but it was really the work group who went out and spent a whole lot of time gathering input from staff throughout the agency and really bringing that forward and making sure that those voices became a part of the strategic plan. So I think they really deserve acknowledgement for the amount of time and work that they put into this effort. Also, we had some very long, day-long sessions that included the Board of Health members and our executive team to get this product done. And I guess finally, I just really want to thank all the staff who really committed to providing the input and being engaged in the process. This was very rapid pace and took a lot of time. But I think everybody so far, from what I'm hearing, feels pretty good about the product that came out of it. And staff is really, from what I'm hearing, is feeling really good that they do feel their voices were heard and were a part of the plan. I think hopefully you've had a chance to actually read through what was in your packet. A couple of things I want to note is, as you can see, this is a pretty focused strategic plan. We limited it to 4 goals and a small group of actions to get those done, really focusing on very high priority issues, things that will really enhance our capacity as an agency and really help us move forward in getting our vision accomplished. This is not meant to be a comprehensive operational plan. It really is very focused. It also doesn't attempt to define some new direction for public health. And that's probably why you'll see that our mission, vision, and value statements did not change radically. We're still doing what we do. We still are what we are. So before I go on, talk a little bit about the goals. Any questions on these sort of foundational statements? No?
Todd?
Okay.
I do.
Yeah.
So, first of all, nice job. Great document. My question is, I know that at the state level, the State Department of Health is still working through its, how would I say this? Redesign, I guess. I know that
The foundational services?
The foundational services. So I know that they're looking at what's happening at the federal level. We're talking about redefining public health at the state level. And so not just redefining, but rebranding. And at some point, I'm assuming in the next 1 to 2 years, I think it's Secretary Weisman's hope to really have that completed. Is the thought that, at least with regard to the specific policy issues, that would be integrated into what we're doing, or at least compared at some later time?
Yeah, a couple of things. The strategic plan, we're really looking at this being a 3-year plan. And as you'll see, it's very focused on kind of internal issues and some things we really want to work on. But throughout that time period and then beyond, we will be watching for whatever else comes up that we might need to incorporate into the next strategic plan or even incorporate into what we're doing now. I think a key thing to remember is just because this is some priorities we're focusing on doesn't mean we're ignoring everything else that's happening out there.
Okay.
So those are definitely on our radar screen. And we know they're coming down the line. It just wasn't the right time to really make any shifts.
Right, got it. Thank you.
Keith? Well, I would agree with Todd on the issue that there's a lot of change going on, especially in the healthcare field, in a lot of ways. And I think it is appropriate to really stay on top of, some of those changes. But I think you've got some big issues in here, like the inequities issue, which certainly could incorporate a lot of the other issues that may be coming down the board as well. So agree with Todd, there's lots to keep track of here over the next couple of years for sure.
Yeah, definitely. So just taking a quick look at the structure we had, we've got the 4 main goals. Then we have strategies that are kind of broader statements about what we want to accomplish. And then we've broken it down into some very distinct actions, things we could really get a handle on and accomplish and be able to see that we're making progress towards the goals. So that's been the structure that we were working with. So there are 4 goals. You can see them there in the packet along with all of the strategies and actions. I think, as I've mentioned, it's a very focused plan, and a lot of it is focused internally. The whole first goal is really about who we are as an agency, how we work together within the agency. Even goal 2, which is all about communication, a big part of that is our internal communications. What can we do to make sure everybody is getting the information they need and feeling engaged throughout the agency? And then even aspects of the other two goals, the one about equity and the other one about addressing emerging and ongoing issues. There's internal elements to both of those as well. So before I talk about next steps, any other questions, comments about the goals, how we got here?
Thank you, Mr. Chair. I just wanted to, I can't believe that you got this done so quickly, so great job. Makes us all go back to our own organization and go, wow, I guess we can do a strategic plan. It doesn't have to take forever. So thank you. But I really like the third area about reducing inequities. We did such a great job a couple of years ago with our health inequities study, and we really started the community conversation throughout the county about health inequities, but I never felt like we articulated that of how we were going to move forward on that. So I really appreciate you putting that in here, and I look forward to seeing how we operationalize that. So thank you for doing that.
Yeah, and thanks for pointing out, this is also a bit of a carryover from the previous strategic plan, recognizing that this was a very significant issue. It takes a lot of work. We made some really good progress over the last few years. So this is really building off of those efforts. So we're really hoping to get to a place where we can start doing a little more action out there. So. Any other comments or questions?
Just a comment referring to what the concern Commissioner Milkey brought up. For our mission, the last phrase is well-being of our communities. It shouldn't matter what the federal government or the state government does. We represent our communities, so they don't.
Yeah, great, thank you. Okay, so next steps. What we've done with the actions within the plan is we've broken these into 3 tiers of prioritization. So those are going to help guide how we end up working our way through the plan implementation. We have developed action plans for each of those items. Those were developed by different staff throughout the agency. Those are really going to provide the guidance for how we move forward with implementation. Those are currently being reviewed by our executive team, and then we should begin action on the Tier 1 items pretty quickly. And the action plans, they contain things like the major steps that'll be taken for each of the actions, resources required participants in the actions, and proposed timeline. And so those are really provide guidance for us to kind of monitor progress and then also hold different people accountable for actually getting those accomplished. Also, I think I mentioned already, lifespan, we're really looking at this being about 3 years. It doesn't mean that we're not going to do anything else. It doesn't mean that once we're done in 3 years, we'll stop working on equity or we'll stop looking at emerging issues. This is just the time span in which we really want to move these items forward and get them started. So, any last questions or comments to make, or you've got the resolution before you? So.
Just a final comment. This is outstanding. This is what a strategic plan should look like, in my opinion. So good job.
Okay. Dr. Letts?
Yeah, thank you. A couple of observations and then a recommendation. As you pointed out, Linda, this is definitely focused internally, and I think that needs to be understood from the get-go. I spent a couple of days in a state I cannot name doing accreditation, site visits for health departments, and working with FAB, Public Health Accreditation Board. One of the questions that we were asked to look at was how the agency's community health assessment, community health improvement plan, and strategic plan were all linked. Mm-hmm. And importantly, how the community provided input to all 3 of those documents. And so I think as this document moves forward, especially with its internal focus, we need to be very sensitive to how we link those 3 elements of improving the health of our community, and then how we garner more community input. And then again, I like the fact that it's a short-lived lifespan, mm-hmm. because again, with things being dynamic and evolving, we need to be very sensitive to that and reflect that in new planning. So,
would you like to say anything about the process? Means you one of the board members that were involved?
I will, yes, and I will say, unfortunately, I was only at 2 of the 4 meetings. But I think what Linda alluded to was that it was a very, very valuable process for staff to be able to be heard and to voice concerns. I mean, the common theme from the 2 meetings I attended was just that staff felt very empowered by the ability to present their concerns, their observations, and next steps. And I think I will give great credit to Linda to really facilitating the process. She did a wonderful job of moving us forward on times where we got stuck, and we got stuck a couple of times, but she was very good at kind of keeping us going.
And I think Kevin also would relate that same information that you're speaking to, Bob, is because he felt it was an outstanding program, and what you came up with. He said that his strategy plan extremely went well, so he wanted me to thank you and all the other members of that committee because well, you got it done.
Yeah, we got it done.
Yeah.
And it really was a team effort throughout the agency, and particularly the work group and then the board members participating. So just great thanks to all them and their hard work.
Okay. Any other? Todd?
Just want to point out, when I talk about keeping track of what all is going on in public health, the discussions that are going on that maybe the board's not totally aware of, that's been going on for a year and a half, I think, have really been about, when we define public health, there are those services that should be available to every citizen of the state, no matter where they are in the state. And things like, you should be guaranteed some level of assurance that when you eat at a restaurant, if you're traveling across the state, that when you eat at a restaurant, that there's some reasonable assurance that it was properly inspected and the food handling practices are proper. That when it comes to communicable diseases, that you have, a reasonable chance that if there's an outbreak that they're contained. Public health. So that's really the dialogue, which is trying to define what are those things that every citizen everywhere in the state should receive, and which level of government should pay for it. And the thought is, if it should be a baseline level of services available to all citizens, that the state needs to step up and play a bigger role, because we have seen greatly diminished funding for local public health departments and agencies for the last 6-7 years. Dramatic reductions. And then there are those services that are specific to a region or a community within the state, where it's more the responsibility of those local jurisdictions to step up. And I've been told this is a bad example, but for example, if you're a coastal community, your local health department most likely is going to have a program on shellfish because it's a big part of the community. You're much less likely to see that as part of a health department in Whitman County. So that's the whole notion that they're going through right now, is to define which are those core things that should be distributed across the state and paid for by the state through local health departments, and which of those are local. And I'm just saying, once they complete that dialogue, that we will have to respond in our strategic plan to say, okay, how do we implement that? How do we carry it out? And what does the revenue stream look like when it comes?
Mr. Chair.
Yes, ma'am.
I'd like to make a motion that we adopt Resolution 15-01, adopting our 2015 to 2017 strategic plan.
I'll second.
Second. Any further discussion? All those in favor signify by aye.
Aye.
Those against? Thank you very much. Now we're down, no reports for board member check-in, and what I would suggest at this time, unless you have something extremely important to state, that for saving time, I know we're going to be busy, that I would just simply, we move to number 10, the executive session, and move forward, and we're all going to go up to room 350. Keith?
I did have one thing that I mentioned to you
Oh,
earlier. Is now
that's important. Go ahead.
I just wanted to mention to all the board members, I know someone mentioned this quickly a while back, that NALBO was having a webinar series around public health law, which sort of relates somewhat to the changes in public health. I did listen in on the first webinar, which was sort of an introduction to public health law, what it is. I thought it was very valuable because it talked about the differences between the authority of public health versus the limitations that government should have on them to creating issues for the public. So some really good discussion about that. There are 3 more webinars coming up in March, April, and May. If you haven't listened in, I would suggest it was really helpful for me as a non-public health sort of individual to understand it from their perspective. So they had an attorney. They also had individual who was doing a lot of public health law research. And maybe the most important part was the resources that they pointed to, and I can make those available to Ann, and in future meetings, she can share that resource information with you. But I thought it was a very helpful educational tool for board members, and hopefully some of you can participate in future months. It's just an hour-long webinar and easily accessible from your own office computer, wherever you are. So thanks, Chuck, for that.
Okay, I'm sorry.
We'll make the information available to everybody.
Okay, anything else? Anybody? Yes.
Out of respect for the citizens that ended up showing up today, and I'm just assuming that some of those citizens ended up taking some time off work, and no disrespect to the doctor, but I do believe that the citizens' business has priority over the evaluation that we're going to be discussing. So I would like to respectfully ask serious consideration for flopping item 10 with item 11 so that we can get through the citizen input.
Mr. Fagan, I would go ahead and say that's the case. We'll be no longer than 3 minutes in our executive session. And the reason why is that we have to make sure we have a quorum. And I'm afraid that if we continue that way, we may not have a quorum because a lot of the members on this group are going to have to be leaving. So I respectfully know what you're asking for. I'm not trying to take anything from you sitting there, but we do have an executive session we have to take care of. So at this stage, I'd say that what would you like to say?
Well, I agree with Councilmember Fagan that we represent the citizens. We got to respect them, whether we agree with what they're here to say or not. And normally, my understanding is normally citizen input's at the beginning of the meeting, not the end. So the least we can do is switch those two things around. And if there's not a quorum, then we just wait till the next meeting to do the health officer evaluation executive session. We can put that at the beginning of the meeting next time.
Well, Mr. Pace, my concern is that we weren't able to do it in December. We didn't have a quorum in January.
I understood.
And so we do have a quorum. We need to take advantage of that and get it done. Any other comments from any of the members?
Would there be any consideration for polling the board members as to their availability for the rest of the day?
That's what I just asked.
Thank you, sir. Because I'm here.
Mm-hmm.
I'm here.
Any others would be leaving?
For what time?
Well, it depends on when we get through with the hearing. If it's 4:30, 5 o'clock, why?
I'm here until 3, and then I have another.
You have to leave at 3?
I have to leave at 3. I have another meeting that I cannot get out of.
I would prefer to get the executive session done, especially since we've already waited 3 months on it. I don't have any reason to think it can't go quickly.
Well, like I say, it's going to take less than 5 minutes.
So let's just get it done so we have a quorum. It's ridiculous to keep pushing this off
Okay,
month after
what's the
month.
consensus? We want to continue, go to executive session? We have 2, the rest of you?
I have to leave at 14:30.
2:30.
Well, let's do this. Michelle, let's go ahead and it's not disrespect for you people sitting there at all. This is a concern that we've had to get solved for 3 months now, and I'm afraid if we wait, we may not get it. So why don't you just go ahead and let's go into executive session. We'll go up to room 350 and come right back. We will not just do that point, okay?
And how long are we anticipating, Mr. Chair?
I would say 10 minutes.
10 minutes.
Time for
10
us to get
minutes.
up and
Get up
back
there
to-
and back, 10 minutes. I reconvene the Health District Board meeting. There was no action taken during the executive session. But do I hear a motion, please?
Chair Hafner, I would like to make a motion to include the health officer from this day going forward in the same cost of living adjustment granted for 2015 for all the non-represented employees of the health district.
Do I have a second to that?
Second?
Okay. All those in favor?
Do we have discussion?
Oh, sure.
Mr. Chair, I will respectfully recuse myself from this particular vote here. I do not want my vote to be interpreted in a negative way. Thank you.
Okay. Take it.
I just have a question. What is the proper legal, is it a recusing or is it abstaining? What do we have policies on that?
Abstain from the
Okay,
vote.
so it's basically an abstention. Okay. But you can abstain without a reason.
Yes.
Right.
Okay.
Okay, the motion's been made, seconded. Any other discussion? All those in favor signify by aye.
Aye.
Those against? Okay, thank you. That passes. Okay, at this time, we're going to have citizen input. And I do apologize for having you wait so long, but again, we have businesses too that are critical for us to take. Hopefully you have all signed in. And at this time, let me give you some of the rules. You have 3 minutes.
Someone has to
You can start on the first one. Don't have a second.
Oh. Okay. We do have regulations for this hearing, and that is that we'll give you 3 minutes. What I'd ask you to do, that if you are being redundant in what you're saying, you know, if one person has the same thing, I would simply really ask you to say what you believe in. This is being taped, and so we'll have everything that's being said. And so I'd appreciate very much just some common courtesy for all of us that you have deliver what you would like to say, and within the 3 minutes. So with that, I would like to have Rosemary, please. I'm doing it wrong. I got you.
My golly, never let it be said that I took more than my time, unless I wanted to. Rosemary Waldron Larson, Green Acres. I've been attending these meetings since May 1997, and I'm allergic to fluoride. But because fluoride is used to make GMOs and antibiotics, drug medicines, I am also allergic to them. 3 years ago this month, when I was GMO food poisoned, I nearly died, but there wouldn't have been any reason for me to go to the hospital like most of you do, because they would have killed me. The interesting part about it is nobody would have known what killed me, because not since the 40s have they included fluoride toxicology in autopsies unless ordered by a court or the attending physician relative to the state's laws or the laws in that region. You know, this country was founded in 1776. It was in 1779 that the concept of vaccination began, and there has never been any scientific double-blind controlled test to prove the safety or the efficacy of what you call vaccination.
Are you through?
I'm through.
Now, for those in the audience, she's been speaking to us almost monthly for a number of years, and that's the quickest and the shortest speech she has ever given. So congratulations. Okay. Lisa Papella. Lisa, no, you can't. Lisa Papella, please. Is that correct? Did I pronounce it correctly?
Yes, Lisa Papella.
Members of the board, my name is Lisa Papella, and I am extremely concerned about House Bill 2009. I used to hold a very pro-vaccine view like most of you. I am a cancer survivor, and when I was declared cancer-free in 2007, my doctor advised me to get Merck's Gardasil HPV vaccine. I did so without hesitation and immediately suffered serious side effects. I lost my ability to see, hear, and speak for short periods of time, and I suffered transischemic attacks every few days, and that has been happening for several years. My legs and arms became very heavy and weak, and I would occasionally lose my ability to walk. Numbness and tingling took over my hands and feet, and my face became paralyzed. I am diagnosed with Guillain-Barré syndrome and palsy, which are listed as side effects on Merck's package insert. I have been dealing with this for the last 8 years of my life. 6 weeks ago, I had my first life-threatening stroke that landed me in the hospital. This vaccine has destroyed the quality of my life, and I would never advise anyone to take the Gardasil vaccine. Now, under House Bill 2009, state representatives are forcing me to cripple and medically assault my children with this very same vaccine, along with other vaccines. Based on the comments received from representatives, it is obvious that there is an incredible lack of understanding how exemptions work. Medical exemptions are very hard to get approved for because you have to provide proof that your child is allergic to an ingredient in vaccines or prove that your child has been previously injured by a vaccine, and the medical exemption would only apply to that individual vaccine. It is hard to prove a vaccine injury because our doctors are quick to deny vaccine injury claims. Having been to over 20 doctors myself, only 2 doctors were even willing to listen to me about my adverse reaction to Gardasil. Religious exemptions are very limiting, and they use wording that puts parents under stipulations. If my children have an adverse reaction, nobody will be held accountable for their injuries, as hospitals, governments, and vaccine manufacturers sit comfortably on full legal immunity. If being a protective mother makes me an anti-vaxxer, so be it. This is a violation of our human rights and a direct act of war on parental rights. Tell me how logical it is to allow people to have the choice in the medical procedure of abortion, but not have a choice in the medical procedure of vaccination, especially since they have been deemed unavoidably unsafe by our own U.S. Supreme Court. We have a right to sovereignty over our bodies. If there are risks involved, there must be rights involved. I am respectfully asking that you oppose House Bill 2009, and I am in support of Mike Fagan and his view on the freedom of choice. Thank you very much.
Thank you, Lisa. Melissa Garcia, please.
I am Melissa Garcia, and as a healthcare provider, I oppose HB 2009 because if the exemption is removed, then the state is deciding the risk versus benefits assessment for me and my children, and my right to make an informed decision is taken away. If we look at the facts and the science involved, we can see why parents continue to question the safety and the necessity of vaccines. There is no independent conflict of interest, peer-reviewed studies that have been conducted to prove that current recommendation for the CDC vaccination schedule is safe. Many families are coming forward with stories of adverse reactions to vaccines, and we are so quick to dismiss them. Aren't we supposed to determine knowledge through scientific method by experiments and observations? Anecdotal evidence is useful in observation and can assist in the research. Those supporting mandatory vaccinations are being dishonest by not acknowledging the families who have been negatively affected by vaccines. Please remember that vaccination is a medical procedure, and we should have the right to deny medical procedures. If physicians are allowed the right of philosophical exemptions according to the AMA, we as parents should have that very same right. Thank you.
Thank you. Nancy Babcock, please.
I want to mention that I saw the your foundation statement said to improve and to promote health. And so I think that requires all of us to look at exactly what that means and not necessarily believe everything we've been told for decades. And I want to talk about HB 2009, and I oppose it, and I support Mike Fagan. I'd like to read a statement from Dr. Toni Bark. Toni Bark received her Bachelor of Science degree in psychology from University of Illinois in 1981, her medical degree from Rush Medical School in 1986. Dr. Bark completed her pediatric residency training at the University of Illinois, trained at New York University in pediatrics from 86 through 87, and rehabilitative medicine from 87 to 88. She, post-residency, worked as an attending staff at the neonatal intensive care unit at Michael Reese Hospital. Then she took a position at the director of pediatric emergency room at Michael Reese Hospital. My purpose of saying that is she's a very qualified physician. I will quote from her. I trained as a pediatric intern at Bellevue, NYU, and then rehab medicine. I was quickly offered the directorship of the pediatric emergency room at Michael Reese Hospital in Chicago. While I had initially been furious if parents came in and were not up to date on their children's vaccines, this attitude changed, and changed drastically. I began to see patterns. Children who were seen in the vaccine clinic would come to our ER with seizures, respiratory arrest, and asthma attacks. I began to realize not all children respond well to vaccination, and in fact, some die. It wasn't until my master's program in disaster management at BU, which I began in 2010 and finished in 2012, that I began to see the fraudulent nature of how vaccines are being marketed and the corruption in the advisory committees. I had not even been made aware of the Federal Vaccine Court. I had no idea that the Vaccine Court had paid almost $3 billion since its inception in 1986. The vaccine adverse events reporting system is not well advertised, and the government admits it only receives 10% of adverse events which occur. I'm 55, and I've only received a handful of vaccines. Today, infants receive 14 different vaccines by age 1, and by age 18, that number is 58, and in some states with flu vaccine mandates, the number is much higher. One more note. A note on the flu vaccine mandates. New Jersey and Connecticut were the first states to mandate flu vaccine for all preschoolers, school-age children annually. This has done nothing to reduce flu cases in their states. In fact, both states are the highest grouping for flu every year. Is that my time? Okay. Thank you.
Thank you very much. Gary Babcock, please. You're not speaking? Okay. Gary Edwards.
Thank you for listening to us. Concepts not on official national political correctness agendas, such as not having an approved view on vaccinations, we've got to make sure that they don't automatically apparently make one not eligible to represent cities like Spokane, or for you to decide in a similar fashion. If they want to declare Mike Fagan as not being fit to express a view that is commonly held by many citizens, but not them, that's an issue. We've got to try to, we don't want to see public ridiculing of publicly elected council members in any city in Spokane County, and to strip him of a position simply because he doesn't agree with a few people on the board in Spokane. Councilmember Fagan is in good company for being attacked by the politically correct movement nationally. He joins with nationally highly respected medical professional, Dr. Ben Carson, who speaks against political correctness as being one of the greatest dangers to our country today. I am discussing the issue with several doctors, and I'm coming to the conclusion that we need Mike Fagan's voice. I'm a patient of an immunologist for years. A side impact of what is being considered is how a heavy-handed approach could impact the work of others appointed to represent any city. If the city of Spokane censures an elected city council member because they don't agree with him and take him off a board, will they be, others representing the city of Spokane or your cities, be anxious that they might inadvertently offend the more progressive wing of the city councils and without notice be replaced? Will they be asking themselves, what would Stuckert do? What would Stuckert say? I now question the integrity of any board in the county just because of this, the way this is being handled by the PC majority of the Spokane City Council. A similar political correct issue in the news recently is global warming. News revealed an international scandal involving detailed research that shows that temperature measurements records from around the world and over decades have been systematically changed through U.S. agencies to fraudulently show global warming exists when it doesn't. This is now being investigated by a congressional committee. You remember Deep Throat, the Washington Post. Follow the money. Every scandal has a money trail. There's a lot of money spent to influence medical policy. I've been involved in a lawsuit that succeeded in getting an FDA medication off the approved list. You better make sure you're right before you start committing our lives to not even having another voice.
Thank you very much. Jessica McGuire.
I'm a mother, and I love my son, and I oppose HB 2009. I believe we need to keep informed consent for all medical procedures. We also need to recognize that vaccines are just that. They are medical procedures. We must retain the right to refuse medical procedures as well. I speak for myself. I'm concerned that if HB 2009 passes, that this will create a slippery slope, and I'm also aware of a very interesting document that honestly I didn't believe when I first heard about it, and it's a 52-page National Adult Immunization Plan draft that became available on February 5th. This year, 2015, and it's on the national, it's by the National Vaccine Program Office, which is set up at the U.S. Department of Health and Human Services website. It goes into detail about all the vaccines that they're hoping every adult in this country will be given. There's not a one-size-fits-all when it comes to medical practices, period. You don't go to a doctor to be issued the same prescription or the same plan that the person that came in just before you was issued. None of us would sign up for something like that. And that's what HB 2009 wants to do to our children, regardless of maybe their health history, their DNA, some other factors that play into piece. I do feel that this is a great state, and I'm very concerned, again, where HB 2009 could potentially take our state. I believe that we need to keep all three exemptions firmly in place. Thank you for your time.
Thank you. Tim Bean, is that correct?
Ben.
Thank you.
Chairman, Board, thank you for hearing testimony. Kind of had a prepared testimony, but after seeing the meeting go on, I want to bring up a few things. Mr. Baldwin, during discussion on one of your agenda items, said that there is no need to discuss, document, or recognize dissenting voices. That's dangerous.
But we're not here to assassinate board members. Get to the point, please.
I'm working on that, thank you. And the danger is that minorities under our form of governance, representative governance, it's important. That's the only way that dissenting voices, minorities get heard, and we can't just ignore those. So I got a notice just today while I was in this meeting that my daughter's supposed to have a chickenpox vaccination, but she's already had chickenpox. So we'll see if I get a parental consent on that or not. I don't know what HB 209 is going to do for every vaccine. And I appreciate the gal's testimony on Gardasil, because over my dead body. This board, the state, the federal government, their policies do not do an end run around our constitutional rights. Please realize that. Thank you.
Thank you very much. Cindy Marshall? She left. Marianne Lonan. Okay. Was that L-O-N-A-N?
L-O-N-A-M.
M. Okay, thank you.
Thank you for hearing our testimonies. I want to tell you right up front that I support Mike Fagan, and he speaks for the people that don't get a voice. And back in 17, we had someone bring up our history. I'm going to give you a little history lesson again. 10% of the United States, of the people at that time in the colonies of the United States, did want to go against England. The remainder of the people did not want to go against England. So because you're sitting here as board members instead of Parliament or something else, this has to still remain, that we have a voice, no matter what you think. Now, I also I'm a Gulf War vet. I've had many injuries, vaccinations, secret vaccinations, all this kind of stuff. Do you know how many people that I've served with in the military that are adults that suffer seizures on the middle of the freeway? They have a seizure. They're with their children. They have a seizure. These are things that are brought on. Are they vaccine related? Well, I kind of think they are. But you're going to tell me that I have no proof. Well, you know what? You're a perfectly healthy individual until you receive thousands of vaccines, and then all of a sudden you develop injuries. So yes, these things need to be investigated, and they need to be put back and just say, you know, we're on a road here that we're going down that we have no idea how to stop it. It's a train. And they, just like the gal had stated, that they want to start vaccinating adults. Well, the thing is that every disease that comes along, they want to create a vaccine. You know, so you develop herpes. They want to create a vaccine. So your children are going to receive hundreds of vaccines, which they already do. We need to really look at this. And the thing is I eat clean. I happen to be, I'm not Jewish, but I follow the Jewish foundation. I eat clean. I don't eat horse meat. I don't eat pus from a infected kidney. I don't eat, anyway, my children, I want their DNA clean. I do not want their DNA contaminated by aborted fetuses. Do you even realize that they use aborted fetuses to make up the brewery to vaccinate your people with? This stuff is criminal, period. And we need to really think about what we're doing to our children. Thank you.
Thank you. Anna Thompson or Timpson?
That's me. Poppy, come here. Sorry for the delay.
She can testify also.
Yes, she could. She's got something to say. She'll say it.
My name is Hannah Thompson. I'm a mother of 3 daughters. This one's Poppy. She's my redhead. I'm not pro-vaccine or anti-vaccine. I'm pro-choice. I believe that medical services should include informed consent. And if you take away informed consent from us, the customers who choose to go to health providers, then you remove the power from us. And that doesn't feel good for anybody. So I support everybody, but I support choice. Thank you.
Thank you very much. Carolyn. Do you need some assistance, Carolyn?
No. Why doesn't she talk right there?
Right here.
You bet. Why don't you use the mic?
I just have been sitting so long, my backside doesn't do anything but, anyway. I have been here off and on for many years. Thank you. I don't like to walk up that far anyway. I have the paperwork from all the inserts from your vaccines. I got them right after 2007 when I saw a picture in the paper of a woman who was saying, "Did vaccines kill my baby?" It was her first and only boy. And I started reading up on them. I did research on those, and I've done research, and I've looked at all that's in it. Measles, mumps, and rubella. I know what you can use at home. Cream of tartar, which is potassium tartrate, and calcinite. You can use that at home, and they're getting it at Huckleberry's now in little packages so that you can put what you want out. So you can get the way to take care of your measles, mumps, and rubella. And our daughter, my husband's daughter, had passed something in her clothing, and she brought it to him and says, "What is this, Dad?" And he put it in a bottle and took it to the doctor, old-fashioned doctor, sent him home with potassium tartrate. I went to the library and asked for research on it, and they got me a medical book about this thick and had everything in it on parasites, gonorrhea, syphilis, the whole thing. And I read through it completely and found out what cream of tartar or potassium tartrate was. It comes from the bottoms of wine kegs for making wine. It's from the seeds and skins of grapes. And this is not from the seeds or skins of grapes. They have fetal bovine, recumbent human albumin, stabilizers, neomycin, and when I was doing some more research, I got the book, the medical test book for people by Dr. Sobel and Dr. Ferguson, and neomycin causes a problem with the pH factor of your urine, and I'm not watching yours, Karen.
these things are important. People should realize that not only do they have neomycin that causes a problem with your urinary tract, they also had aluminum in this. And I've got all of the inserts, and I found out what pertussis was, or for the vaccine. It's a histamine reaction in your body caused by the vaccines and caused by the wind blowing all the genetically modified weeds, seed dust too, and it causes you to cough and everything. I have so many bits of information I can't give it all at this meeting, or have never been able to, because they always wave a card at me. But if you're interested,
we're waving a card at you now.
If you're interested in having the information, so you don't have to have, you say "what if" in front of anything you say, which is what I'm doing to protect myself from anybody that isn't. And my husband told his doctor, "Don't worry, you have a medical degree." He's dead now, by the way. He was taking Coumadin.
Now, Carolyn, I only gave 3 minutes to everyone else.
I'm going to give
so
it right
common
now.
courtesy for all of them, please.
Anyway, the whole point is I'm still alive, and I only had a high school diploma, but I'm still researching, and I'm saying to you, research it, and as Mr. Padden said, use your own discretion, look things up. Don't just rely on the health board, because they're being given phony information about governance too.
Okay, thank you. Next is Kayloni.
And it's respectfully
submitted in good faith, as I always am.
I know. We've really got to know each other the last 3 years, haven't we? Okay, thank you. Okay, Kaylani, is that how we pronounce that? Is that the correct pronunciation?
Kaylani.
Kaylani, thank you.
So I did just print out, just as an example, since measles is the biggest media frenzy right now around measles. So this is, and she probably, I didn't hear what she said, but just a few of the things from the package insert from Merrick on the known side effects for measles, the measles vaccine, vasculitis. I'm just touching on a few of them: pancreatitis, diabetes, anaphylaxis, chronic arthritis, encephalitis, polyneuritis, polyneuropathy, transverse myelitis, febrile convulsions, aseptic meningitis. Of course, there's a really long list. And then I'll just read what I have. How dare you mock, this is especially to certain members of the council and people in the media that aren't here, I suppose. How dare you mock parents or people like Mr. Fagan that through their own research have formed convictions regarding the risks versus the benefits of vaccines that may differ from yours or the status quo of the medical community. Freedom and justice can only be experienced in America to the extent that it is not infringed upon. What is more invasive and oppressive than forcing a drug to be injected into a child that is preventative, in theory, not imminent to the treatment of the emergency treatment of a child? With known side effects, like the ones that I mentioned when I began, and unknown side effects yet to be officially acknowledged, against the parent's will and wishes. There's no justification for this. Clearly, many members of this Health Council would be better suited to serve on boards in communist, fascist, or totalitarian governing nations, like China, ones that force all vaccinations to be compulsory. I doubt you guys will sign up for that anytime soon. In the meantime, this Health Council needs to stop the attack on freedom of information, freedom of conscience, freedom to informed consent by your onslaught of mockery. And I'm not blaming everyone on this council, but I know that there are some members that I've seen, especially on the Spokane City Council and direct, so I don't want to blame any of you that haven't. But for those that have, onslaught of mockery and censorship towards those who do not agree with you on the vaccine issue. Clearly, this council or some members of it should have clearly this council needs to have someone like Mr. Fagan on it that will stand for parental rights. It is an outrage that every single one of you are not insisting on parental rights as the most crucial aspect of the vaccine debate. It will not be soon forgotten or forgiven if you remove Mr. Fagan from this council for such an erroneous reason as denying him the freedom of his own intellectual integrity. It surely would be a testimony that you say the pledge in vain as a liar and a hypocrite. Freedom and justice for all. Retain Mr. Fagan.
Thank you very much. Mary Ellen May? Is that Mary Ellen?
Mo.
Oh, Mo. Okay, thank you.
Thank you so much for listening to us. I just would like to say how much I've appreciated listening to all of the testimonies here. And you have a choice. You can either be dismissive of the testimonies because possibly we are just the regular run-of-the-mill people of the community, or you can hear. I mean, there was nothing said today that wasn't backed up with information that you can go to their sources or personal testimonies. Everything here was very credible. I think the thing that is the scariest of all about this whole issue is the element that's moving in our whole country to totally control everything we do. It's rampant, whether it's vaccinations or whatever it is. I just recently read a report about foster care parents who, if they don't have the flu shot, they can't take care of foster kids. You know, this should scare us all because it's like the old axiom that I can't think what it was, but they came for the Jews and I wasn't a Jew, so I didn't worry. They came for the Catholics, I wasn't a Catholic, so I didn't worry. But then they came for whatever is your issue. And so I'm just saying we have to at some point realize that the root of our freedoms are being challenged. So when you look at this issue, one of the things is that it's a fact that there is insufficient data to determine whether or not vaccines provide a net benefit. It's insufficient. There is no way to determine the risk factor, injury, or even death for any given individual. We can't do that. I mean, I can debate. I have a son who breaks my heart. He is 33. He cannot work. He cannot hold a job. I'm telling you, he was diagnosed years ago with ADD, whatever, but he's closer to autism. And you know, I mean, I can tell you there's a difference when they're vaccinated. There is. The other kind of side note to bring in is the money motivation for pharmaceuticals. Okay, here's a couple of things, and this is all backed up information if you want to see my sources. The National Childhood Vaccination Act of 1986 shields vaccine manufacturers from liability for death and disability caused by their vaccines. Did you know that? By this act, they're shielded. Merck, manufacturer of the mumps vaccine, is going to trial in 2 separate lawsuits for allegedly falsifying the efficacy rate of its mumps vaccine. The pharmaceutical industry is the biggest defrauder of the federal government under the False Claims Act. So we're going to go with this kind of information and just, you know, because I was amazed when Mike was under all this assassination, all the things that came out in the paper, all the letters to the editor, all of the comments were all piling on Mike. And I'm saying there's got to be willingness to hear credible other sides to the story. Thank you.
Thank you very much. Are there anybody that we have forgotten that would like to speak? Would you mind coming up to the stand, please?
Thanks for hearing us today. My name is Amber Wood, and this is a very emotional issue for me, but I'm a mother of 2. And with my last pregnancy, my first pregnancy, I had a C-section, and I had planned a natural birth, so it was not how I wanted things to go. And I felt like I was told how everything was going to go, and that I just had to do whatever the doctors say, because they're the doctors, right? So when I was pregnant with my second child, I did a lot of research, and I said, I'm going to be in charge this time. This is my body. This is my baby. This is my birth. So my daughter was due on July 5th, 2013, and that date came and went. A week later, I was still pregnant. And so many people said to me, oh my gosh, I can't believe your doctor's gonna let you go that far. Well, I don't know if you know this or not, but C-section rates are through the roof. I can't tell you how many people go in to have a baby and come back with a C-section, okay? So recovery is difficult, especially when you're a new mom, you don't know what you're doing. My point is that I shared with people, listen, this is my body, my baby, my choice, okay? Another week came and went, and I was still pregnant. My body, my baby, my choice. Meanwhile, two of my brother-in-laws are doctors. My best friend is a Yale-educated PA. Okay, I have a lot of medical people in my family. Everyone's going, I can't believe your doctor's gonna let you go that long. Okay, I know what's best for me and what's best for my body and best for my baby. And as a woman, having my birth stolen from me at my first event, I am here to say that medical procedures should be choice. Okay, I had a very healthy baby. I had a vaginal birth after cesarean, which is called a VBAC, if you ever heard that term. Anyways, my whole point is that this is about choice, okay? These are medical procedures, and HB 2009 takes that choice away from us. And so I just ask that you just respect that out of choice, okay? The decision for me to stay pregnant and not be induced, that was my choice, and that was what was right for me. So anyways, I just want to put it in another context about medical choice, so thank you for hearing me.
Thank you very much. Is there anyone else we forgot? Yes, ma'am.
I didn't sign up, so I'll give you my name, Roxanne Layton. I just thank you guys so much for listening to us. We just appreciate it because sometimes at council meetings nobody listens to us, and so I really say thank you for doing that. And I didn't plan on speaking, but I just wrote down a note. And as a parent and an average American person, I do have a right to make an informed and knowledgeable decision about my children's health care. I don't want to feel pressured, bullied, or harassed into giving a vaccine to my child, ever. I don't want pat answers like this is the way we do it. I want information about vaccines beyond what the pharmaceutical companies and the Center for Disease Control offer. And I just appreciate that you're letting us say how we feel, because we're just average American people. And then I just wanted to make a comment regarding what Mike Fagan said on his Facebook. People forget what he said. He had a sentence, and at the very end he said, "Only science will tell." It seems like people aren't realizing that's what he ended his sentence with, and I think that's awesome that he would want to know more science about vaccines. And one thing that I know you guys care about, because you do represent us, is if you take him off of this board, you're telling Mike Fagan and all of the people of Spokane that a person cannot look into the truth in something. They cannot look for middle ground on an issue. They cannot feel comfortable about being uncomfortable about a hot issue like vaccines. And aren't we all adults here? Don't we all want true education about vaccine? Thanks.
Thank you very much. I do want to clarify one thing. It is not this board's responsibility to dismiss anybody from this board. So I wanted everybody to know that. Now, no more, please. We've had your statement. So at this stage, any comments from the board? And I put a motion for adjournment, please.
So moved. Second.
All those in favor?
Aye.
Aye. Thank you very much, and thank you very much for being here.